Fentanyl, some kind of opioid, was first synthesized in 1960 by Dr. Paul Janssen, a Belgian chemist and founder of Janssen Pharmaceutica. Designed as a potent analgesic, fentanyl was intended to manage severe pain, particularly during surgical procedures, offering up to 50 to 100 times the potency of morphine. Its development marked a significant advancement in anesthesiology, with the drug approved by the U.S. Food and Drug Administration in 1968 for medical use. Initially administered via injection, fentanyl's rapid onset and short duration made it a preferred choice in operating rooms. Over the decades, its pharmaceutical forms expanded to include transdermal patches, lozenges, and nasal sprays, marketed under brand names like Georgesic and Actic for chronic pain management. The illicit use of fentanyl emerged in the late 1970s when clandestine laboratories began producing it for the black market. The first notable outbreak occurred in California in 1979, linked to world chemists, leading to multiple overdose deaths. This marked the beginning of fentanyl's dual identity as both a life-saving medication and dangerous street drug. The 1990s saw sporadic illicit production, but the opioid crisis in the youth outsense, particularly in the United States, escalated its prominence by the ties earned fentanyl, often mixed with heroin or pressed into counterfeit pills resembling oxycodone, became a leading cause of overdose deaths, prompting global attention. Research on fentanyl has focused on its pharmacology, therapeutic applications, and public health implications. Pharmacologically, fentanyl is a opioid receptor agonist, binding with high affinity to produce analgesia, sedation, and euphoria. Its lipophilic nature allows rapid brain penetration, explaining its quick action, but also its overdose risk due to respiratory depression. Studies such as those published in the International Journal of Drug Policy have explored fentanyl's intentional use among people who inject drugs, highlighting its role in overdose risks in urban settings like New York City. Therapeutic research has refined delivery methods to optimize safety. Transdermal patches introduced in the 1990s provide sustained release for chronic pain patients, though misused. Cutting patches for injection has been documented. Nasal sprays and sublingual formulations have been studied for breakthrough cancer pain, with papers in Pain Medics showing efficacy with reduced side effects compared to morphine. However, research also addresses overdose with naloxone, with naloxone remaining effective, though some studies suggest higher doses or repeated administration may be needed for fentanyl overdoses. NIDA 20 Public health church dominates current efforts given the opioid epidemic. The IDA reports that in 2024, the DEA seized over 60 million fentanyl-laced fake pills and 8,000-pound and burned, touting its prevalent. Studies on prenatal exposure indicate risks to pregnant women and fetuses, including reduced prenatal care access. Epidemiological papers, such as those in the Lancet, track rising mortality rates, linking fentanyl to over 70% of opioid overdoses in the U.S. by 2020. Several seminal papers have shaped fentanyl's understanding. Early publication in Journal of Medicinal Chemistry detailing fentanyl synthesis and potency, laying the groundwork for its medical use. Higgins and Orr, minus billions or analgesia and analgesia of this paper were evaluated transdermal fentanyl's efficacy, influencing its adoption for chronic pain. And I see it all. Released or in Journal of Drug Policy, this mixed method study analyzed intentional fentanyl usinols, offering insights into harm reduction strategies. Better yet, it's all fentanyl's awarded courtesy. Japan treatment guidelines provide their brand research contributions.